I'm Joan Edelstein, grandma to a fully vaccinated 6-year-old. I'm also a professor of nursing with a doctorate in public health, now teaching school nursing. I started nursing school in 1965. At that time, one of my favorite mystery writers was Agatha Christie. I've read all of her books, but one that always stands out for me is one that I read shortly before I started nursing school. Her 1962 murder mystery, The Mirror Cracked. It's also a 1980 film with Elizabeth Taylor, Rock Hudson, Angela Lansbury, Kim Novak, good cast. Anyway, Miss Marple is one of Christie's main murder detectives. Her friend Heather Babcock is so excited to meet Miss Marple's neighbor, American actress Marina Gregg, newly arrived to England because Heather is a big fan. Heather launches into a story with Mrs. Gregg about how years ago the actress was in Bermuda where Heather worked, and she was such a big fan that she left her sickbed to get Miss Gregg's autograph. If you don't already see it coming, spoiler alert, Heather Babcock is murdered by actress Marina Gregg. What was the motive? Heather had long ago exposed Mrs. Gregg to German measles when she was pregnant. As a result, Mrs. Gregg had a mentally disabled child from congenital rubella syndrome, along with a nervous breakdown. It actually gets more interesting. Agatha Christie later shared in her memoir that the story was influenced by American actress Jean Tierney, who had been infected with rubella, German measles, the one time she was at Hollywood Canteen in 1943 when she was pregnant. Her deaf, partially blind, developmentally disabled child was institutionalized, which is mostly what happened to severely disabled children at the time in state hospitals. More than a year after she had the baby, an excited fan asked for Tierney's autograph and said she had broken quarantine 2 years before when she had had German measles at the Hollywood Canteen, though Tierney didn't murder the fan. Back to when I started nursing school in 1965, because we were just coming out of a rubella epidemic here and across Europe between 1963 and 1965. In the United States, we had over 12.5 million diagnosed cases of rubella. We know there were more because you can have mild cases without symptoms. Estimates are that over 11,000 pregnancies ended in miscarriage or stillbirth. Over 2,000 newborns died, and over 20,000 children were born with congenital rubella syndrome. And remember, in the 60s, many of those children were institutionalized. We saw a lot of infants and children with congenital rubella syndrome. One outcome of the epidemic was intensified efforts to develop a rubella vaccine. Doctors Saul Krugman and Lou Cooper at NYU Bellevue, where I worked in the pediatric emergency room, participated in vaccine development. I was asked to be in a clinical trial, but it turned out when I had my blood drawn for titers to see if I had had rubella, I did, but I never had symptoms. A vaccine for rubella was licensed in 1969 and became part of the MMR, measles, mumps, rubella vaccine in 1971. We're talking a lot about measles vaccines these days, and for good reason, given the outbreaks in which 2 children died in the US alone. Of course, when we don't vaccinate for measles, we also don't vaccinate for rubella because it's a combined vaccine. We don't see congenital rubella syndrome anymore because of those vaccines. Without them, rubella will quickly return. So if you're questioning, remember these stories and maybe have an even better understanding of why it's still so very important to vaccinate.